Welcome. I'm really fortunate today to be with Dr. Ty Dunn, who joined us recently in our division of transplantation. And Ty, you've already gotten a reputation in the operating room for just being a master surgeon. I want you to know that, as probably the people watching this video will know, the people you really want to talk to are the nurses, the technicians, and they just absolutely love working with you. They could probably move your schedule a little bit to the day and kind of drift away from those night operations, but that's part of being a transplant surgeon. So tell us about Ty Dunn and where you grew up and how you ended up getting interested in medicine.
Well, that's pretty interesting to me, hopefully to other people, but I'm from Iowa, which maybe isn't a super exciting place, but there's a lot of really good people in Iowa.
Absolutely.
I'm very proud to be from Iowa. And one of the projects I was given in high school was to write, like one of your first essays kind of thing. And I picked the topic of forensic pathology because at the time,
wow.
yeah, I was watching Quincy, Jack Klugman.
Yeah.
And I thought Quincy was so smart, and his sidekick Sam, they helped families and they figured stuff out, but I liked the idea that the patients were already dead and I couldn't hurt them. And so
Yeah.
I thought maybe this would be an avenue for medicine that would be appealing because,
Wow.
he served a purpose and it was really cool and I liked how he helped families. And so I wanted to learn about that. And so I learned the difference between medical examiners and coroners, and I interviewed the local funeral home guy, and I just got interested in science as a college
Oh, wow.
opportunity. And no one in my family had ever gone to college, so I was like floundering, right?
Yeah, wow.
But I ended up going to college in St. Paul and majoring in biology.
Yeah.
Yeah.
So Hamlin College, right?
Hamlin University.
Yeah, Hamlin University.
Yeah.
So what's Hamlin, how has that been there a long time?
Yeah, 1854. It was one of the first
Wow.
colleges in Minnesota when it was like still a territory.
It
before
must
was a
be
state.
named after someone named Hamlin, right? Maybe? I didn't
I
didn't prep you for that question, but
No.
we'll look that up. We are giving a very nice shout out to Hamlin University, though.
Yeah.
And then your interest in medicine continued, and then to
Yeah.
the University of Minnesota.
Yes, I had an opportunity to do like a senior thesis for my biology major, and I did that in cat coat color genetics. And I was very interested in genetics and all sorts of things, but I didn't do so well in organic chemistry. So I started to think maybe
I'll join you there.
I started to think maybe I was not going to be able to go to medical school, and I, for a brief time, thought maybe I would go into virology and immunology. And so then I came to my senses and, took the MCAT and all that. And
Sure.
yeah.
And the rest is history.
Yeah.
That's great. How did you decide on surgery?
I think I've always been very interested in how things work. I'm kind of oriented towards kind of understanding mechanisms and fixing things. My dad had a body shop, and so I grew up kind of watching what he did, and it's as much of a skill as it is an art. He did a
sure.
lot of fiberglass work and a lot of like Corvette repair, so he's like a regional Corvette expert.
Oh, wow.
Yeah, and so then back in the 70s, people are like putting flames on their motorcycle tanks and stuff like that.
Oh, yeah.
So I got to see a lot of creativity and a lot of heart and soul into fixing things. And in the garage, there's always a different tool for a different thing. And so I'm fairly picky about my tools, as you know. But
Yeah. Great.
yeah, I learned that from my dad.
And then residency at the University of Illinois, right?
Yeah, yeah.
Okay.
Yeah, I didn't know if academic surgery was something that I was going to be interested in, and I wanted to be, number one, well-trained in clinical surgery, but I wanted to go to a place where I'd have an opportunity to do research if that became an interest of mine. And so that program wasn't my first choice, and so for all the medical students that don't get their first choice, don't worry, it all works out. But
Oh, absolutely. There are
Yeah.
very few who get their first choice, I would say.
I ended up spending 3 years in the lab, getting a master's, and having a baby, so it was fairly productive research time, and ended up in transplant.
Oh, that's great. And then you went back to Minnesota
Yes,
for your fellowship, right?
yes, yes.
And then how did you kind of narrow down your scope, because you're mostly kidney and pancreas?
Yes.
How did that evolve? And then talk to us about life before
Yeah.
you finally came to nirvana here at the Medical College of Wisconsin. Give us that little period of time.
Yeah. So interestingly, all of my research in my residency time was in hepatocyte transplant. And so I guess I think of myself as a cell transplanter through and through, both islets and hepatocytes. And, so I trained in all organs, and I'm certified in all organs, and my first job was all organs. It's hard to find an all organ academic job.
Yeah.
But I did, and then I landed at the University of Iowa, and it was great. But the whole time I was there, they didn't have a division chief. And then finally an opening came up at Minnesota, and I thought that would be like the best place I could ever possibly be, because of course I trained there, and it's the seat of transplant. First pancreas transplant in the world was done there
Wow.
in 1966. So I was blessed to be able to come back on faculty at that institution, and you know, they just said, well, we already have enough liver surgeons. We really don't have a space for you to do liver surgery. And I said, okay, it's still a good deal. So academically it was, and I had great mentors, and had a lot of opportunity.
Wow. And
Yeah.
you ended up coming here from the University of Pennsylvania.
Yeah, yeah.
Yeah.
So I was recruited to the University of Pennsylvania in 2018 to lead the kidney and pancreas program. I'd already been leading the kidney program for a short time at Minnesota and the living donor program for a few years. And I wanted to test my leadership wings and do that. And in order to do that, my husband is a family practice doc, and so he was going to stay with his group practice for about another year and a half. And I was going to be busy in Philly anyway. And then COVID happened.
Oh, boy.
And that was hard. We ended up staying apart for about 3.5 years. And I don't have any family on the East Coast, and neither does he. So when this opportunity came up, it was just like a no-brainer for me. And to join, you know, our division chief, Matt Cooper, who I've known for more than 10 years and
Yeah.
would trust
Oh,
with
that's
my
great.
career, it was a really wonderful opportunity.
Well, so lucky for us. Most of the people who watch this video are probably the lay audience, medical students thinking about coming here for their residency, and various faculty thinking, or recruited faculty thinking about coming here. What are you excited about in transplant? I know there's so much going on in medicine, but the changes that you think will occur maybe in the next few years that will make a difference. I know that whenever I listen to talks on transplantation, there's always the challenge of there just aren't enough organs. People are living longer. The organs that God gave them seem to be pooping out at various times, and there just aren't enough alternatives. Where do you think we'll be in kidney and pancreas transplantation in the next decade or so?
Great question. You know, I think the issue right now is exactly like you said. It's a little bit of a rationing issue, and to be able to give people the freedom from dialysis and other supportive therapies, depending upon whatever their organ failure may be, is really limited by, you know, organ supply. So we've had a big focus here on living donation and paired kidney exchange, and one of the big initiatives is to try to find the organ to which you are least likely to recognize, because you know it's always not yourself, so you'll need immunosuppression forever. But if you need less immunosuppression, we can maybe help that organ live longer and also prevent other things that can occur, like infections or cancers down the road. So in order to really maximize the life of the organ, we really need to start out with the best quality organ, and to do that. On the other front, a really exciting time in transplantation is the ability to do machine preservation, both in cold storage and in warm storage. And this allows us to do transplant in the daytime.
Exactly.
Yeah.
So right now, explain that to a few people who may not
Yeah.
be knowledgeable about that.
Yeah, so when either a brain dead or you know, a person that's going to expire after withdrawal of care who intends to donate their organs, those organs undergo some stress during that whole experience. And so we can resuscitate those organs through pumping them with a special solution that gives them, you know, nutrients and supportive therapies. And
So it makes the kidney think that it's actually
alive.
inside
Yeah.
someone's
Yeah,
body.
it makes urine on the pump. Yeah.
So human blood goes into the artery, go into the kidney, and then out the vein.
Yeah, and in kidneys we use a non-blood-based
Okay.
perfusion, but there's some therapies now, are especially in liver, using blood, and like livers make bile. Yeah, we have
Yeah.
the breathing lung. I mean, there's all sorts of things, and to think about how you can apply medical therapies on the pump to help recondition organs or to treat organs to like defat livers and make them usable could really expand the organ supply.
Wow.
Yeah.
So that way you can also be a little bit more secure in your diagnosis that kidney is actually okay to put into a patient, because otherwise, before you had this ability to assess them, you just had to use your judgment by looking at them and maybe would you occasionally do a biopsy or something? Or
Yeah, for a lot of organs, we do biopsies to assess the structural health and any
Yeah.
chronic conditions that may be present that would otherwise escape our detection with our clinical judgment. But for example, when machine preservation is happening, you can measure bile, you can check lactate, you can understand the metabolism of what the organ is doing, if it seems normal or abnormal, and you can make better decisions. For example, if you have an organ that you think is maybe marginal, you can put it on the pump and assess whether you should use it or not.
wow,
Yeah.
just fascinating. I know that the last question for you, Ty, is there's been some work looking at other animals. So, you know, could perhaps a primate kidney or a pig kidney or something, would there ever be a role for using kidneys from other animals in humans?
Yeah, there's a lot of intense work in xenotransplantation, which is what you're talking about, where you're putting a non-human organ into a human. That's the xeno part of it. And so, you know, there have been transplants now of pig hearts and pig livers and pig kidneys.
And the pig seems to be the
Yeah.
the most adaptable
Yeah,
animal.
yeah. There have been pigs that have been, you know, kind of genetically modified to have human-appearing tissue proteins, and those tissues are then more able to be acceptable for transplant. There's some nuances with that, and a lot of things are being worked out, but early successes have happened, and I think we're getting ready to have some actual trials now.
Wow.
Yeah.
Well, my last question, what do you do, not that you have much time outside of work, but hobbies, what do you do, what do you like to do outside of work?
Yeah, I like to spend time with my husband, which is why we live
There
together
you
now.
go.
Yeah.
Okay.
35
so
years.
that's a success right now.
Right.
Yeah.
Right. You know, I live in Milwaukee proper, and there is a prestigious 98th Street Book Club that I was asked to join.
Oh, great.
I've never done that in my life, but it's been really great because usually I'm conditioned to fall asleep when I'm flat, so I have a hard time reading books, but this keeps me maybe a little bit more current, and it's been fun
Yeah.
to meet the ladies and do things with them.
Oh, that's great. Well,
Yeah.
Dr. Ty Dunn, thank you so much. We're thrilled that Milwaukee is your home right now.
Thank you. Nice to
Thanks.
be here.